So I come in into the patient's room, I wash my hands, I close the door for privacy, and I introduce myself. Hello, my name is AJ. I'm going to be one of the nurses that's going to help take care of you today. I was wondering if I can ask you a few questions and do an assessment. Is that all right with you? Sure. Great. What is your first and last name and your date of birth, please? Oliver Queen, January 10th, 1964. Thank you, Mr. Queen. Let me ask you a few questions. What year are we in? What city and state are we in? What hospital? Date and time, please. Sure, we're in 2021, Clearwater, Florida. We're at Morton Plain Hospital. It is November 7th, and it's 12:30 p.m. Mr. Queen is ANO times 3. He is clean and well kept and is not complaining of any pain or have any complaints. Mr. Queen, I want to ask you a few questions. Are you married? Do you work? And what type of job do you do? And do you participate in any physical activities? I'm recently married. I work in finance. My wife is a nurse. I'm always sitting down on my job, and I don't really work out or participate in any activities. Thank you, sir. I'm going to go ahead and move on with the rest of the assessment, starting with your IV. First, I assess the IV, and I see no signs of erythema or edema or an inflammation. There are no kinks in the tube. I flush the IV, and it flushes well. The patient does not complain of any pain at the moment, but I will go ahead and educate the patient about it. Mr. Queen, your IV looks great. There is no inflammation. You say that it doesn't hurt. It flushes well. So we're going to continue to use it to administer medications. If anything changes, if you have any pain or swelling or redness, please let me know. Okay, understood. Have you experienced any fatigue or chest pain or shortness of breath recently? No fatigue or chest pain. I do get a little short breath sometimes when I'm sitting down and get up and walk or do some other activity around the house. But my doctor says that it has to do with my CHF or something like that. Yes, sir. So I did notice that you do have an incentive spirometer and at bedside. So have you been using? I try, but sometimes it's hard to do. I will now teach the patient how to use the incentive spirometer and have them demonstrate how to use it. Yes, sir, I understand, but let me go ahead and talk to you a little bit about the incentive spirometer and how to use it. So the reason why we use it is to help you expand your lungs. So the way that you want to use it is to put the mouthpiece in your mouth, take a slow, deep breath as much as you can, hold it for about 5 seconds, and let it out. You can rest in between, but you can want to do that a few times an hour. Okay, I'll continue to try it. So, Mr. Queen, if you start experiencing increased shortness of breath or fatigue or chest pain, back pain, please let me know. Those are things that we definitely want to address, okay? Mr. Queen, have you experienced nausea, vomiting, or diarrhea recently? And what was your last bowel movement? No, I haven't experienced any nausea or diarrhea. I'm pretty regular. I went just before I came to the hospital today, and it was normal. Mr. Queen, I'm going to go ahead and listen to your bowel sounds now to assess for digestion. It may take up to 5 minutes per quadrant if I don't hear any present bowel sounds. All right, sounds good. So I went ahead and listened to all 4 quadrants, abdominal sounds, and they were all present. And the patient had no complaint of pain or any discomfort. Mr. Queen, how have you been urinating? Any pain when urinating? Any increase or decrease in frequency? When was the last time you actually urinated? I go a lot during the day. The doctor put me in this pill, this water pill, for my heart failure, I guess. So I go a lot. I just went 5 minutes ago before you came in. Yes, sir. So I see here that you're on Lasix, which is a diuretic, which is the medication used to treat heart failure. This medication helps your body get rid of extra fluid, helps remove fluid from the lungs to help you breathe better. So that may be one of the reasons why sometimes you may having some shortness of breath upon activity. And it helps you keep the swelling down if you're experiencing swelling in your extremities. That makes sense. So the plan is to check your weight daily while you're here. We're gonna monitor your urine output, so we're gonna have you urinate in the urinal, and we're gonna continue to assess your pedal pulses to make sure that they are there, and as well as the edema in your legs. Do me a favor, go ahead and squeeze my fingers tight. Okay, well, I'm gonna put my hands under your feet, and I'm gonna have you like as if you were pressing on the pedal. Okay, now the other way. Okay, so we're gonna continue doing those exercises to make sure that your extremities remain strong while you're laying in bed. Also, every time you urinate and you're gonna get up, we're gonna go ahead and go slowly, because sometimes the medication may make you feel dizzy. So please let us know so we can go ahead and help you, okay? I understand. Will do. Any tingling on or numbness in your extremities, Mr. Queen? No. All right, Mr. Queen. So that concludes my assessment. Is there anything else that I can do for you? Do you have any questions or anything like that? No, thanks.